So to that end, my doctoral dissertation looked at the question of what is the meaning of the lived experiences for students with ASD attending college and university? To answer this question, I used an in-depth qualitative approach called Interpretive Phenomenological analysis, which examines the meaning of personal and social experiences of individuals to better understand a phenomenon, something we don't know much about, in a detailed, comprehensive, and flexible way. Participants are viewed as experts in their experiences, and their perspectives are highly valued and respected. This was really important to me because too often the voices of students with disabilities are overlooked, minimized, or unsolicited. So I really wanted to provide the opportunity for students with ASD to lend their voice in this study. This approach, IPA, is concerned with the transferability of the research findings, not the generalizability of the research findings. So this isn't going to be the experience of all students with autism spectrum disorder, but the results are meant to transfer to people reading the dissertation that I know you're going to Google tonight, hopefully, and think to yourself, how does this transfer to my clinical practice? What implications does this have for research questions moving forward? So it's meant to have a lot of clinical and functional applications. I had 12 students diagnosed with either high-functioning autism or Asperger's disorder. This was DSM-4 TR days, hence the changes in the diagnostic terminology there. I had 9 males and 3 females. They were all enrolled in either college or university, and they represented 5 institutions. And they were undergraduate students, years 1 through 3, and I included 1 graduate student as well. And they ranged in age from 18 to 28. In terms of data collection, I engaged in in-depth, in-person, individual, semi-structured interviews, which really allowed for a flexible yet in-depth discourse regarding their experiences. And I also had a follow-up interview with each participant, which provided them the opportunity to share more information. Maybe they thought about things after the interview, ask questions, clarify thoughts, and for me to engage in member checking, which is a validation strategy that I'll describe in a moment. Very briefly, transcripts were analyzed case by case, starting with the first interview. It's iterative, so I was looking for shared and particular experiences across the participants, and I really took an active role in the analysis of each transcript. In qualitative research, it's very important to ensure scientific rigor and credibility of the research findings, so it's recommended that at least 2 validation strategies are used. It was my dissertation, so we implemented 5. I'm just going to highlight the third one, which is member checking, because it is a crucial strategy in qualitative research. This is where I took a summary back to each of my participants, and I had them read it, and I asked them, did I get it right? Did I understand your experience? Is the meaning correct? Is this an accurate reflection of your experience? And that was really important because I could have gone off and interpreted the data, but maybe it wouldn't have fit with the meaning of their experience. So really important that we did that. And so from the data analysis arose 8 broad themes and corresponding sub-themes. I don't know if that's difficult to read, but I am going to be focusing on theme 3, which was managing autism spectrum disorder and related symptoms. Okay. So in this theme, the broad theme really illustrated the experience of these students having to manage both ASD symptoms and related or co-occurring symptoms while attending college or university. Now, with respect to managing ASD symptoms, some participants conveyed that their preference for routine and restricted interests have been helpful in post-secondary education. So, for example, fixating on subjects and doing really well, whereas other participants indicated that their restricted interests distracted them from their academic work. Many of them also reported difficulties with sensory dysregulation. Further complicating this experience of not only having to cope with ASD symptoms, participants really expressed their how their academic difficulties exacerbated symptoms of depression, ADHD, OCD, and in particular, anxiety, and how these symptoms impacted their academic functioning. So it was almost a negative feedback loop. Now, I have a few quotes here to illustrate what my participants conveyed with regards to this theme or this experience. ASPs are kind of, regular specialists. We tend to fixate on subjects, and when we do that, we tend to excel. Because our minds are so fixed to that, and we just go at it. So we're able to, if you give us a subject to work in, we tend to do really well. the bottom quote, Zach shared how his restricted interests, I can definitely get caught up in things like playing video games or such because it's something that interests me more instead of completing his homework. The next few quotes are about sensory dysregulation. As an ASD, I have a very sensitive nose. I smell things very easily and I hear things very sharply. So partying may not be the best choice, but that's where you meet people. I really like the bottom quote. In a room with 100 people, every shuffle movement I can hear, like every scratch of a pencil, causing Lindsay to focus on the background noise rather than the lecture. Now, with regards to managing related or co-occurring symptoms, many participants shared their experience of depression while attending college or university, which resulted in either taking time off of school or staying in school and becoming further depressed. William, in the next quote, shared his great difficulty managing his symptoms. I was making little gains in both academic and in personal development, and having terrible mood swings all the while. And it got to the point this year where I was going, I don't deserve to go through life hating myself and wanting to die. I don't deserve to put myself through agony in order to try and reach my goals. I don't deserve the pain I put myself through and how hard I am on myself, which is sort of why I'm taking a break from school. The next quote really illustrates challenges with depression and then also the hygiene associated with that. So first term, I was heavily depressed. A few people approached me and I turned them away. I gave them a stare I would normally use to defend myself against the bullies. I would be very withdrawn and not try very hard and be very indulgent, like repetitive videos. I knew I was very pointless playing video games, not caring much about my hygiene. I guess I would still take a shower every day, but I'd leave things lying around. I guess my room in a way, it sort of reflected my mental state. And he was a student that lived on campus. A common thread among several participants in this study was the way in which anxiety impacted their functioning in college or university. This common experience was described with conviction and in great detail, particularly with respect to how anxiety affects their academic and social functioning. So the next quote illustrates this. I'm very, very, very anxious, very awake, very clenched, constantly repeating the information over and over and over again, constantly looking at the book, just constantly rereading lines, and if I don't understand them, getting very frustrated. I will, start speaking them out loud over and over again, trying to encode it. So Stephen was talking about preparing for an examination that day. The bottom quote really nicely illustrates the social aspect of academic world, so to speak. So I'm anxious about getting into study groups because usually they're sort of, small social groups already, and I'm coming into them. And I know that my behavior can sometimes be a bit odd, so I don't want to distract from that. So I am going to skip over a few of these quotes just for the sake of time. Participants also reported physiological symptoms related to anxiety, such as increased heart rate as well as insomnia. Jeff shared that he ruminates over his academic difficulties, which leads to insomnia requiring melatonin or medication. He described a 5-day period of insomnia, which he indicated was one of his more dangerous experiences in college. Marcus shared that his insomnia leaves him tired during class, and as such, he's grateful for a voice recorder so he can have what he missed out on. Chemistry, like I said, lab really stressed me out just because there's so much to adapt to, and it kind of comes to the part about me not feeling I'm meeting up to the expectations and hurting myself because of that. But the reason I dropped chemistry was I got insomnia. I couldn't sleep for 5 nights, so that really was not fun. Okay. And this was about having depression as a result of not sleeping properly and having challenges in his classes. So what implications does this have for practice? I think this study, and in keeping with the theme of this conference, really highlights that there are co-occurrences of psychiatric conditions in autism spectrum disorder, and we really need to work towards minimizing diagnostic overshadowing. So sometimes what happens is the larger diagnosis masks a lot of the challenges with respect to anxiety and depression, and sometimes those symptoms are just attributed to the autism. But it's really important to know that they can co-occur, and many of these students can reach diagnostic threshold requiring clinical treatment in the area. And I think that's something that even professionals need to learn more about, and families and schools, etc. I think to do this, we need greater knowledge and capacity building, so teaching of recognizing what the signs and symptoms of mental health issues looks like in autism spectrum disorder. My colleagues did a really nice job of that this morning. This includes training for service providers and the unique treatment needs, such as school teams, community mental health teams. So some of our community mental health teams may or may not have mental health clinicians that have expertise in treating individuals with ASD, and that is a barrier. It's a barrier to treatment. College and university campuses have disability offices, which is fantastic because we know mental health issues in post-secondary education is challenging for a student, even without a disability, but a lot of these individuals don't have that specialized training in autism spectrum disorder, so really increasing disability awareness among college campuses, the professors, the counselors, and also students without disabilities. In terms of treatment, I'd like us to think contextually and ecologically to prevent and minimize mental health issues in ASD. And thinking about this when children are young, when they're children, when they're teens, before they make that transition to post-secondary education. So for example, if we can provide really good social skills treatment, maybe that will reduce the severity of symptoms or even minimize or prevent the onset of psychiatric conditions. For example, there's a randomized control study looking at the PEERS program, which is an evidence-based social skills treatment program for teenagers with autism spectrum disorder. And the program has shown to be very effective in reducing social skills, but a study has also shown that engaging in social skills interventions such as PEERS has also reduced social anxiety. So if we treat different areas of the child's functioning, hopefully it can minimize the onset or exacerbation of symptoms. Independent daily living skills, executive functioning, and environmental modifications. How can we implement little strategies to minimize the sensory dysregulation that we see in students with ASD? Okay. This in itself is a talk, greater transition support, so understanding the fundamental differences between secondary school and post-secondary settings with respect to accessing educational accommodations. So that includes capacity building for school staff teams, and then post-secondary programming and support. So disability awareness, like I talked about, we're seeing lots of peer mentorship programs coming up, and we need to start evaluating those programs. I know SFU just evaluated theirs, which is a wonderful start. York University is doing exceptional work. And then also really looking at, is it the purview of universities to provide social skills intervention and employment training for students with ASD? And I think it is, so that's going to be a policy discussion, I think. I want to leave you with this quote because I think it's quite meaningful. This was Zach, and he said, "Thank you for doing this research because they forget about us after high school." And I think that this means a lot of things. To me, it resonates in that let's not forget to, let's continue to do, provide clinical training and clinical treatment. Let's continue to do research in the area, but let's not forget to ask the students, what is it like for them? Because I think that's quite meaningful. Thank you.